All right. Hi, everyone. Welcome to the National Spine Health Foundation Facebook Live. We're so excited to be talking with you today. I'm Erica Anderson, and today we're chatting with our CEO, Dr. Rita Roy. Thank you so much, Rita, for talking with us today.
Yes, thank you for having me. It's just it's a privilege and a pleasure to be here. Got a lot of things that we want to say, and I'm excited to respond to your questions and share some good news during this time.
Yeah, like everyone else in the whole country right now, and really the whole world, we're sort of focused on the coronavirus or COVID-19, as some are calling it. That's really all that we can think about right now. And honestly, there's actually a lot that is related to what we do at the Spine Health Foundation that we can talk about. And so we want to talk about some of those things today. Rita, can you talk to us a little bit about what is the Spine Health Foundation offering for people as they transition to working from home? Sometimes for the first time they're experiencing this. What are some of the things that we're focusing on at the foundation?
Yeah, so Erica, it's an unprecedented time. We all know that. College kids, high school kids, elementary kids are distance learning from home. Adults are teleworking, and our lives have been disrupted. And we are on a mission at the Spine Health Foundation to educate Americans about ways that they can take care of their spine and why it matters. And in moments like this, it's really, really important to think about your posture, how you're working, and how you're taking care of your body. I mean, I think that there's never been a more important time than now for the messages that the Spine Health Foundation gives people in terms of taking care of themselves. Someone said, our bodies are not going to know how many days we were teleworking. Our bodies are not going to know how many days we were in quarantine. But when we come out on the other side of this pandemic, we're sure going to either feel better or feel worse. And at the Spine Health Foundation, we want to make sure that we are getting our messages out far and wide, that there are things that you can do during this time to take care of yourself. We often quote the numbers that United States Bone and Joint Initiative has done a lot of these studies on the numbers of Americans that are affected by neck and back pain, debilitating neck and back pain for many of these Americans. And the numbers are staggering. 100 million Americans are struggling with neck or back pain. And, that's a third of our population. That is 1/3 of the American population. It's a staggering number. And it means that you or someone you know is probably struggling with a back condition. And what we want to do is give information to people who have ongoing challenges, what they can do while they're at home. And we want to give information that's preventative so that people don't develop bad habits, but in fact, develop good habits. They say it takes 2 weeks to develop a habit. We've got a couple of weeks of being at home or being in quarantine. This is a really good time to think about things that maybe we don't always take the time to think about during our busy lives. So I think that's what, that's what we want to do during this moment. And I'm so thrilled that you've invited me to come online today, because this is the moment where taking care of your body, taking care of your spine, minding your posture, is going to really help you as we turn the corner on this pandemic and return to normalcy in our lives. We need to be strong. Our bodies need to be able to perform for us, because there's going to be a lot of work to do as we get back to work.
Yeah, I mean, because working in an office comes with its own issues. And we've put out a lot of content about, how do you work at a desk and what are things you can do in the office? Like, that's a huge part of some of the resources that we regularly put out. But when you come home from the office and now everyone is sitting on the couch, they're working from, maybe someone's sitting in a beanbag chair. I mean, there's so many, we think it's great. Like, it's going to be so comfortable, right? But there are so many things that we need to remember to protect our spines. What are some of the tips that we've been offering to people just to keep in mind and to keep up as a habit on a daily basis as they're working from home?
Yeah. So thank you. That's a great point. Just this week, we released our monthly Spine Spotlight newsletter. And this month's newsletter focused on strengthening. And we draw from yoga. which is a practice that is well known to give core strengthening, which strengthens your spine. And so if you look at some of our, if you look at our Instagram page, if you look at our Facebook page, perhaps you're a subscriber to our newsletter. And if you're not, you can easily do that on our website at spinehealth.org. And what we do is we try to create consumable information. So brief nuggets of information that these are, boil it down to the simplest tips and techniques that we can give that make it easy. Because there are small things you can do that have a big impact on your life and on your body and on your wellness. So you can take a look at some of those materials that we've released just this week and all month long. And when it comes to your desk, now I'm even doing that today. I'm sitting at a desk that I don't normally sit at. And as I came to this desk, I thought, this computer's too low. I'm leaning forward. My neck is lunging forward. So I got some books. I elevated my laptop. I'm sitting with my feet on the floor, and I'm using my own, our own tips to make sure that as I sit in this chair, I'm sitting with my back straight, with my feet on the ground, with my laptop at the right level. And so those are some of the things that we've been putting out. And that's true whether you're working at home or whether you're working at your office. A couple of other tips that we tell people is to make sure that you stand every hour. Some people have the luxury of having those desks or the computer tabletop platforms that they can raise so that they can stand and be working at their laptops. But if you don't have that, it's no reason to not get up, stand, do a few stretches, and maybe set a timer so that twice an hour you make sure that you're getting up and you're moving your body. Another tip that we tell people about is sitting on one of the exercise balls instead of a desk. That can give you some really good mobility and stability, as you're sitting at your desk and positioning yourself for work. But again, it's a combination of things that we encourage people to do. Find what works for you and just employ these very simple changes into your workflow, and it will give you a very big outcome. And that's what we want to say is that you don't have to radically change your life to feel better. You can employ small changes. You can employ small movements into your daily life that will give you a very, very big impact on your wellness.
Yeah, and I just want to touch on you mentioned habits, but I think that's like really the key thing here. As speaking as someone who has worked from home for quite some time, and since I started working with you guys at the Spine Health Foundation, I have really radically changed some of my habits at home. Great. Because I've mentioned before that I've had back surgery and I do struggle with back issues on a regular basis. But as I've been reading through some of our resources and following the stuff on our website and hearing from the doctors that we work with, like I started to really implement some new things. And it really is just a habit thing. Like I've started really paying attention to keeping my shoulders back. We have a post up right now with some of the online exercise programs that people can be checking out. And one of the ones that I use that I've listed on there, they have like 5-minute yoga, things that don't take that much time that, in the past I might have said, I don't have time for that. Like I'm in a rush. I have little kids, like I'm working, yada, yada, yada. But honestly, now that I've been doing it, I can't skip it because I realize how good it makes my body feel and how much better I feel that my spine health is getting by implementing these daily habits. And you said it takes 2 weeks to make a habit, 2 to 3 weeks to make a habit. We'll start it now. And I think, there's a lot of negativity going on, but this is our opportunity to actually go back to work better than the way that we left it. And would you agree?
Yeah, absolutely. That's exactly right, Eric. I mean, this is the time. This is the moment where many of us are self-quarantining, we're social distancing, we're staying at home, whether we have a large home or a smaller apartment or wherever you are, you're in a disrupted environment where you are not undergoing your regular daily activities. And that is either going to, you're either going to look at that as, in the worst possible way, or you can change your mindset about that and say, this is a temporary period of time. This is not going to last forever. This time will pass. And what do I want to look like when I come out of this? What do I want that picture of my wellness to look like when this time passes? Because that's going to happen. And the actions that you take every day are going to dictate how well you feel when you come out of this pandemic time where we're social distancing, we're self-quarantining, we're staying at home, and it's important to stay at home. So while you're staying at home, think about the crocuses come up, right? The seasons change. This pandemic will turn over. This is not going to last forever. But the changes that you make in your life right now, the habits that you decide to maybe begin to work on now, maybe can last you for a lifetime. And let's make those be good choices. I mean, one thing that I wanted to touch on today also, Erica, and we write about this in a lot of our material, is that, sound body and sound mind. There's a very strong mind-body connection. We all know about that. The studies all indicate that. And if our bodies are feeling good and feeling strong, we're mentally going to be in a better mindset to be able to cope with the challenges of returning to normalcy, because the new normal is a little bit unknown. I mean, things are not going to be exactly the same as they were before. We don't know what some of those challenges are going to be as we return to our jobs or our work or our places of work. Hopefully everybody will be able to go back to their jobs and return to their lives. But whatever it is, it's going to take clear minds, positive attitudes, and a strong body to cope with the changes. So now is the time when we have limited activity for the other things that normally distracted us maybe from building our own personal good habits. We don't have to take our kids to practices. A lot of the pulls on our time have evaporated, for better or for worse. Let's make that be for the better for right now. We have a choice to make, and the choice is to work on our personal wellness and also maybe your family's personal wellness. We have some tips and tricks of things that you can do as a family. Get your kids involved in it. We talk about back conditions in sort of 3 buckets, and I just want to take a second to talk about this. Spine health is a big arena. There are a lot of conditions that are in the world of spine health, and we try to sort of think about it in 3 main categories. There are disc issues, so those cushions that are in between your vertebral bodies, those are the discs. There are disc issues. Then on the other side of the spine health universe, there are injuries and trauma. So car accidents, everything from a car accident to a sports injury, those are injury and trauma. And then there are those systemic conditions are things that affect our spine, like inflammation, arthritis, osteoporosis, or conditions like scoliosis, or conditions that affect the anatomy of the spine. So you've got everything from disc issues to arthritis to scoliosis to trauma, and that's a huge arena, right? So in all of those areas, it's important to think about, how do we take best care of our spine? Our spine carries our body for us, right? So if our spine is strong, our bodies are strong. And ways that we make our spine strong is by making our core strong. So that's why this month we've focused a lot on strengthening, on yoga poses for strengthening, on activities you can do to strengthen your spine through the soft tissues that support your spine. We've got lots of material at spinehealth.org. Our Spine Talks platform has some of the nation's leading experts, some of the best and brightest minds in the spine world, giving information about how best to take care of your spine in many of these different conditions, in many of these different arenas. So when it comes to family time, given the breadth of areas that are that incorporate spine, there's all kinds of reasons why everyone in your family, from the youngest member of your family to the oldest members of your family, can incorporate some of these strengthening activities to take care of their backs. Whether you're in a prevention mode, you're trying to prevent neck or back pain from occurring, or you're managing a chronic condition that you don't want to get worse. There are lots of reasons to use this time, even as a group, amongst your family. Build the good habits, use our information to help you, and come out of this pandemic stronger.
Yeah, I think this is such, I mean, when there's so few other things that we can do, we can really prioritize what matters and set a good foundation for when life gets back to normal. Well, thank you so much, Rita. Is there anything else that you wanted to add or just mention before we sign off?
I wanted to mention one more thing, Erica, and we mentioned this in this month's newsletter as well. Um, as we are social distancing, as we are staying at home, one of the few things that we are sort of allowed to do, or is available to us to do, is to make those important visits to the grocery store. And many of us, myself included, my family included, you get into kind of a snacking routine when you're at home, and you're sitting at home, and maybe you're tuning into some funny shows that are lifting your spirits, and finding ways to laugh every day. But as you're doing that, and as you're going through the time at home, and you're thinking about snacking, we want to encourage you to think about healthy snacking. Feeding your body well, being mindful of nutrition, making sure you're getting proper nutrients in is going to be really important during this time. Will make your body strong, will make your mind strong. And a friend of mine, Leslie Saracen, is the CEO of the Food Marketing Institute, FMI. They represent the grocery chains, and she put out a note recently about the resiliency of the supply chain, the food supply chain in America. And I have personally been impressed by going to the grocery store and really finding an abundance of fresh fruits and vegetables that were available in the store. And for some reason, I just thought I wasn't going to be able to find that. And I did. And so, as you're snacking, instead of reaching for all the processed foods or the naughty foods, have your treats, but incorporate snack grapes, apples, bananas. The fruits are out there. The nuts are, in the stores, cashews and peanuts and walnuts and all the wonderful foods that you can be snacking on while you're at home during this time. Don't forget to do that. That nutrition, hydration, and exercise. Also important.
It all works together. Everything all works together, whether you see it or not. That's how it is in the background. Well, thank you so much. I'm so glad we were able to get this information out to people. We hope everyone will head over to spinehealth.org. If you haven't been there, sign up for our newsletter. We want to connect with you. We want to hear your stories. If you have a spinal champion story, please let us know. We want to feature those and just provide hope and information for people that are dealing with these issues every day.
That's right.
Thank you so much.
Thank you.